Hello, I'm Dr. Soumya, gynecologist at Akkineni Hospitals. Hope you're in good health. Let's discuss some essential points today. Stay with us and make notes.
Welcome to This Explainer. Today, we're going to break down the biology, the hidden dangers, and the ultimate solutions behind a disease we actually possess the power to defeat entirely, cervical cancer. You know, it's a topic that's just as medically fascinating as it is absolutely crucial. We're going to unpack exactly how this disease operates and why, despite us having all the right tools to stop it in its tracks, it remains a massive global challenge.
We have a lot of important ground to cover today. We'll start with the cervical cancer paradox, then move from HPV to cancer, recognize the hidden symptoms, look at staging and treatment options, and finally wrap up with the 3 pillars of prevention. Let's jump right in.
Section 1. The cervical cancer paradox, a tragic contradiction. Let's just quickly unpack the sheer epidemiological burden this disease places on the world, and specifically on India.
To really grasp the scale of this, we just need to look at one staggering number: 25%. Think about that for a second. India alone accounts for roughly a quarter of the entire global cervical cancer burden. To put some real human lives to that percentage, we're talking about over 123,000 new cases diagnosed every single year. And tragically, that results in about 77,000 deaths annually. That is a massive demographic hit from just one single disease.
But here is the crazy part, the real paradox of all this. On one hand, cervical cancer is highly preventable. I mean, we know exactly what causes it, it has a precursor stage we can easily detect, and we even have an incredibly effective vaccine to stop it. Yet, the grim reality is that it remains the second most common cancer among Indian women. And you know, this isn't because the biology of the disease is some unbeatable monster. No, it's a direct reflection of a failure in our screening infrastructure and preventative action.
Moving into Section 2, from HPV to cancer, the biological ticking clock. Let's trace the exact path from a super common viral infection to invasive cancer.
So how does this actually start? Almost always with the human papillomavirus, specifically persistent high-risk HPV. Now, a healthy immune system will normally clear an HPV infection in a year or two, but a persistent infection, mainly type 16 and 18, literally sets up camp right where 2 different types of cervical cells meet. The virus then produces these oncoproteins E6 and E7. Think of them as saboteurs. They intentionally knock out your body's vital tumor suppressor proteins, P53 and RB. And once those cellular checkpoints are taken offline, the cells just begin to divide completely out of control.
But here's the thing about this progression. It is a remarkably slow ticking clock. From that initial HPV infection at year 0, progressing through cellular changes, what doctors call CIN 1, 2, and 3, takes years. Literally, it takes a massive 10 to 20-year window before those abnormal cells break through the tissue's foundation and become true invasive cancer. That gives medical professionals an enormous time frame to step in, find the pre-invasive disease, and wipe it out before it ever becomes cancer.
Now, if it does happen to progress to cancer, what exactly are doctors seeing under the microscope? Well, about 75% of these cases are squamous cell carcinomas, which arise from the outer surface of the cervix. But the remaining 25% are adenocarcinomas. These start deeper inside the cervical canal, and the really important takeaway here is that those adenocarcinomas are actually increasing proportionally. Plus, because they hide higher up in the canal, they're often much harder to catch on a standard Pap smear.
All right, Section 3, recognizing the hidden symptoms, the silent threat. So, if we have a 10 to 20-year warning window, why on earth do so many cases slip through the cracks?
Well, the absolute most crucial point to understand is this. Early-stage cervical cancer, stage 1, is very often completely asymptomatic. The patient feels totally fine. Relying on how you feel to tell you if you're sick is incredibly dangerous in this case. And that is exactly why screening asymptomatic women who feel perfectly healthy, is literally the most critical weapon we have. You simply cannot wait for the warning signs.
Because when those symptoms do finally appear in later stages, they can be severe. The most common early warning is abnormal vaginal bleeding, which could be after intercourse, between periods, or post-menopause. Patients might also notice an unusual, watery, or foul-smelling discharge, or even pelvic pain. In highly advanced stages, the tumor can physically block the body's plumbing. We're talking leg swelling from lymphatic obstruction, or even kidney failure because the tubes to the bladder get completely blocked. It is a really devastating progression.
Let's move to Section 4, staging and treatment options, the clinical pathways. Once invasive cancer is suspected, how does the medical system categorize the threat and fight back?
As you might expect, the treatment logically escalates as the disease spreads. In stage 1, where it's confined entirely to the cervix, doctors can often use conservative, fertility-sparing surgeries. But once it hits stage 2B to IVA, where it's spreading to the pelvic wall or lower vagina, surgery usually isn't the main option anymore. The standard of care shifts to a combo of chemotherapy and targeted radiation. Finally, if it reaches stage IVB, meaning it's spread to distant organs, the approach shifts to palliative care to manage the disease and improve survival.
Now, we just talked about these incredible, sometimes curative treatments for early stages. But here is the truly heartbreaking reality in India. Over 80% of cervical cancer cases present at stage 2 or higher. By the time these women actually reach a doctor, the disease is already locally advanced. At that point, curing it becomes so much harder, the treatments are way more aggressive, and it's incredibly taxing on the patient.
Which brings us to our final part, Section 5. 3 Pillars of Prevention, the ultimate solution. Let's pivot away from the grim reality and look at how we can stop this completely before it ever reaches a hospital bed.
The genuinely incredible news here is that the vast majority of cervical cancer deaths can be totally prevented with a simple 3-tiered approach. Pillar 1, HPV vaccination. Ideally, this is the nonavalent vaccine given to girls aged 9 to 14 before any sexual debut. Pillar 2, regular screening, like Pap smears or HPV testing, starting at age 21. That's how we take advantage of that massive 10 to 20-year biological window. And Pillar 3, prompt treatment. If a screening comes back abnormal, doctors can immediately treat those high-grade cellular changes. Comprehensive facilities, like the ones at Akkineni Hospitals mentioned in our sources, rely entirely on executing these exact 3 pillars to empower patients and save lives.
So I want to leave you with this final, provocative thought to chew on today. We have a highly effective vaccine, we have precise screening tests, and we have a massively forgiving 20-year biological window to catch the disease before it turns into cancer. We literally possess every single medical tool needed to eradicate cervical cancer from the face of the earth. The science is solved. The only question now is, will we actually bridge the gap between our medical capabilities and our actions to finally eliminate this disease? Thank you so much for joining me for this explainer, and please share this vital information with the people you care about.